Hello everyone, I am Beatrice Kefazra. I'm here to share with you some tips that will help the new clinical student excel in the clinical arm of your medical studies. Here in the clinical arm of your medical studies, we'll be offering some courses which one, medicine and surgery. So for medicine and surgery, we'll be doing it concurrently with pathology. Pathology is divided into four. We have chemical pathology, microbiology, pathology, and histopathology. Again, you'll also be doing pharmacology and community medicine. So these are the courses offered. How it is done is that you will be doing medicine and surgery for 10 months, and in this 10 months you will still be doing pharmacology, community medicine, and pathology. But after that 10 months, you will stop doing medicine and surgery. Then you will focus on pathology and pharmacology for 4 months. It's usually called a block post. So after that 4 months, you write your part-time family exam. For medicine and surgery, every day from Monday to Thursday, you will be doing your medicine and surgery lectures from 8 to 10. Usually, like on Monday, you start with medicine 8 to 9, then surgery 9 to 10. After which, you all go to your various units for your clinical rotation, either ward round, clinics, or theater. So after that one, you do your clinical posting from 10 to 12. So from 12, you come back for your pathology lecture. So that's how it continues to Thursday. Like on Monday, you will do that afternoon, you will do chemical pathology. Then Tuesday afternoon, you do microbiology. Wednesday afternoon, you do hematology. Thursday afternoon, you do histopathology. And then all the morning 8 to 9, you'll be switching between medicine and surgery. While on Friday, you'll be going down to the main campus where you do your community medicine from 8 to 10. So every Friday you do your community medicine 8 to 10. While from 10 to 12 you do your pharmacology lectures. Then from 12 to 2 is your break time. Then from 12 o'clock to 5 you do your pharmacology practice. So these are the way your lectures go. For this clinical there are some basic textbooks that you need. For medicine, you need Hutchinson. This is a textbook that will help you to learn about the symptoms and common conditions in medicine. For surgery, you need Norman Browse. Then for your pathology, for chemical pathology, you need Martin Crookes. Martin Crookes is the textbook of choice. For microbiology, Livingston is a textbook of choice. Then while hematology, Hofbrand Hematology is the textbook of choice. And then for histopathology, you need your Robbins. And for pharmacology, you need Lippincott and also Essential. So I think these are some of the basic textbooks that I think they are so relevant in this medical school here. And then in addition, there are so many other textbooks. It depends on how you learn and which kind of books you may enjoy, but these ones are basic. Okay, alright, here in clinics for your medicine posting, just like I said initially, it is 10 months. So once you come, your class will be divided into 2. So the first half will be in medicine, they'll be doing medicine posting, while the second half will be doing surgery posting. So each of these groups. In medicine posting, there are so many units, so you'll be divided into units. So it depends on the population of your class. You can either be 8 to 8, 7, 8 or 9 in a particular unit. So you will be doing that posting in that unit for this term one, and you'll be starting with S0 and M0. So S0 is surgery, while M0 is medicine. So for S0 and M0 is 1 month. So the first half of your class, they will do 1 month in medicine, while the second half will do 1 month in surgery. Then you will switch. So after that 1 month, so you finish S0, then you do S1. S1 is 2 months. So the first half will do 2 months in medicine, while the second half will do 2 months in surgery. Then you switch and do another 2 months and switch over. So after that one, then you will do your S2. S2 is the same with S1, it's still 2 months. So that's how you will rotate. Then after this 10 months, you will then go into your blog posting. So in that blog posting, your class will be divided into 4. So these 4 based on the 4 pathology department that we have. So you do one month in each of these pathology. So after which you will be rotating. After that 4 months, then there will be 2 weeks revision. Then you write your exams. Now for medicine and surgery posting. For medicine, the posting is usually not tedious because their calls is usually 1 in 10 days. While for surgery, for people in surgery, there are departments. Generally, most of the department is units in surgery. Their calls are usually 1 in 5 days. But there are units like neurosurgery, pediatric surgery. These units, and plastic surgery, their calls is every day. So if you're in this unit, you know that you will be on call every day. Okay, this is what I mean by call. So if let's say you are doing your plastic surgery posting, so after your morning lecture, all of you will go for your clinical. Either is the clinical now, that 10 to 12, you will be going to where your unit are, what your unit have in a week. So usually every unit have a clinic day, senior resident round, consultant round, and then for a surgical unit, they have their day of surgery. So if you are in any unit, so if let's say your unit on Monday they have rounds, so after your lectures from 8 to 10, you go for the ward round. On Tuesday, maybe your unit have clinic. After your lecture on Tuesday from 8 to 10, you go for your clinics. And then if you're in surgery, maybe your surgery day is on Wednesday. After your lecture 8 to 10, you go for your theater. Then after that, you come back for your pathology. Usually pathology, the lecture is 1 hour, after which you go for practical. Then usually if the practical finish around 4, then if your unit is on call, then you have to go back to your call. Then usually they do release us around 6 because of the security challenges, but there are units that can exceed that time. They can release you at their own discretion. So this is the way the postings are for medicine and surgery and even pathology here. Okay, I'm still on the call. It is usually the call is being done at the accident emergency. So there during the call, you can have some tutorials, some demonstration from your doctors. So then the A&E where emergencies come, you will learn, and every procedure that you watch, there is a space for it in your logbook, so you will sign it. So at the end of each posting, they usually collect the logbook for assessment of your procedures. So, and even though all the rounds, the theater, everything will be signing inside the logbook, but that clinic has a long space that every procedure you watch, maybe you just go to the accident emergency, you saw a particular doctor dressing a wound. Once you watch him, if you watch him, you will write watch, then he will sign. Then if you assist him, you can write assist, or you perform any procedure there, you will write perform. What I usually do is that just ensure you, maybe after your lecture, even if you're not on call, after your lecture on your way home, you can branch to the accident emergency, maybe just 10 to 15 minutes. If you stay there, you can see something that you might not have seen in the world, and probably that's the only time you can see it. So that accident emergency really offers a great opportunity to learn and to see some cases that literally you may not be able to see in the world. So don't allow don't just leave your logbook till when they say submit before you start signing. From the beginning of your posting, just be finding time once in a while, be going to the accident emergency. There you can sign your logbook, and you will fill your logbook to the brim, and you will get your full marks when they come for marking. Okay, here in clinics, the tests are unlike the pre-clinics. They are quite organized here, particularly for surgery. Anytime they usually release a lecture series. So that lecture series, the timetable comes with the date of their test. So, and for surgery, they are so serious that they don't usually miss that date they put on their calendar. So you know that after every lecture series for surgery, you must write your test. And usually the tests are MCQs. And from my experience here, I tend to know that the best way to do well in surgery test is to avoid unnecessary gambling. Just be sure of what you are answering and leave the rest, because their questions are usually not much. There are few questions, and then you do the MCQ, and that's all. You finish it and you pass if you read well. Then for medicine, they are not usually consistent with tests. You discover that it's only, like for us, it's only gastroenterology unit, lecture series, cardiology, and nephrology. These are people that I know they are serious, they give their ball. The other unit, they will come and finish their lecture, they will say test, but the test will not hold. And then for pathologists, pathology usually after a particular lecture series, they write tests. So take for instance like histopathology, there's a general histopathology. So after you finish the courses under that general histopathology, you write tests. Then before the systemic, those systemics, after like 1 or 2 systems, you will write tests. Usually for histopathology, their tests are usually MCQ, and again they ask only a few questions. I think it's only 20 STEM questions that they usually ask. For hematology don't really usually write tests often. Like since we came, it's only 1 test we wrote. So you finish all the general hematologies, then you write tests. Then after the systemics, you write tests. Then microbiology is similar. Microbiology, I think before your blood posting, you may only write 1 test. Like us, we only wrote 1 test, and we'll be starting our blood posting without writing any other. It is chemical pathology that are serious. After a particular series of lecture, they usually write tests, and their tests are essay. So chemical pathology are the department that usually gives essay. And for Proficiche, he's like the main person in chemical pathology. Anything he taught you, anything he tell you, is most likely coming out, and he gives notes, and he usually asks things from his note. So these are the way the tests are for pathology. And then for pharmacology usually you write tests. After your general pharmacology, you write the test. Then the systemic, after each system, you also write tests. And the thesis for pharmacology is also MCQ. So the last but not the least, community medicine. Okay, their own thesis also, just like the way it is in the preclinic, it didn't change here. After each topic, you write a test, and whether the test will be MCQ or essay, it depends on the teacher that will be taking you. Okay, the advice I will give the incoming 400 level student is that first of all, I want to tell you that you should be prepared for this clinical arm of your medical student. Prepared in the sense that you need to be prepared mentally for these clinicals, and you need to settle down. You need to settle down before your lecture start. If you want to rent house, ensure that you rent your house before your lecture start. If you're staying in hostel, ensure that you secure your hostel, or you are staying at home anywhere, just ensure that you settle down so that when your lecture start, that's not when agent will be calling you. You'll be looking for houses up and down. And again, if it is possible, try and finish your registration before your lecture starts, so that you'll be focused. You won't be going up and down. You'll be focused on your studies fully. And again, you need to buy the necessary materials you need to buy, like your scrubs and your scrub shoes. You need to buy your stethoscope, your patella hammer, tape, and then you need to buy your logbooks, because the moment you start, you will begin to sign your logbooks, and they are very key. They are like what will qualify you to write your final exam during the final year. And particularly for surgery now, the HOD now, they are so serious about this logbook. So you need to get your logbooks intact, and even some of the textbooks that I mentioned earlier, you need to get them. So by doing this, you will make yourself prepared for this clinical. And secondly, I want to advise that you should be always around, because here in clinic, you learn a lot by hearing and seeing. So most of the things you meet in your thesis are things that you probably will hear either in theater, in ward round, during your calls, or in class as the teachers are teaching, particularly for surgery and medicine. No, even all the courses here, I tell you, most paying attention in class is very key, because you may not be paying attention in class, things will miss you, and you will go and read the slide, but once test comes, you discover that they will bring out some of the things they mention in class, and it is not in their slide. So by not being around, you will miss it. So be around and ensure that you sign your logbooks properly, because it is very key. And your attendance, but here attendance is being taken very serious, particularly pharmacology, the practical and the lectures. Ensure that you sign your attendance very well. And then here, don't be alone. Interact with your colleagues and even your seniors on academic matters. Have a group discussion, because I tell you, some of the slides here, if you are to read them alone, they can make you sleep. You may not enjoy it, but once you are with people who are together in a group discussing it, it will be easier for you. So please, don't be alone. Always interact with your colleagues and your seniors, just like I said earlier. And again, very importantly, anytime you have a test or end of post or any form of exam, always ensure that you contact a senior colleague, someone that have done that before, because there are some advices, there are some things they can tell you. It will help you, to guide you on how you will read, what to expect, and so many other important things they can tell you. So please always interact with your senior. Ask questions. How we have this test, so what does it take? How is it? So it will really help a lot. And again, dress well, because here they see you as a doctor here, so there is this expectation. So you need to dress well always, so that you avoid embarrassment, and also be punctual to your lectures. So some lecturers don't allow people who come late to enter their lectures. So if you come late, you miss out that lecture, and by missing that lecture, you'll be missing a lot, and you may not be able to sign your attendance. So be punctual to class. And lastly, I'm a man of faith. I believe so much in the help of God. So I encourage you that even as you come to this other half of your medical training, don't neglect God. Always seek the help of God and always follow God even here. Thank you very much.